Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host of the Dean's Chat podcast. For the next couple of months, we're doing some bonus episodes. We're highlighting students from each of the schools and colleges of podiatric medicine. Today, we have 3 students representing the New York College of Podiatric Medicine. All 3 are members of the American Podiatric Medical Students Association, otherwise known as the APMSA. I'd like to introduce each of them individually. Mr. Karan Sharma, representing the class of 2024. Welcome, Karan. Karan's also the national president of the American Podiatric Medical Students Association, so we'll talk about that a little bit. And also joining me, Mr. Ronald Baraga Delannoy. Welcome, Ronald.
Oh, thank you for having me.
You're welcome. And Ronald's representing the class of 2025. And also Ms. Tuba Azam, representing the class of 2026. Welcome, Tuba.
Thank you for having me.
Oh, you're welcome. One of my goals tonight is to discuss your educational experience and give prospective students a glimpse of what it might be like to attend the New York College of Podiatric Medicine. So to get started, Karan, would you please share with our listeners what podiatric medicine is?
Absolutely. Thank you, Dr. Jensen. Thank you so much for having us. And podiatric medicine is essentially a field of medicine that focuses on the lower extremity, so anything below the knee. That involves any type of pathology you can think of. It could be trauma, surgery, outpatient clinics, wound care. Essentially anything you can think of that would affect the lower extremity is covered in podiatry. And one of the interesting things about podiatry is since it focuses on an anatomical region and not a subspecialty or an organ system, essentially the possibilities are endless, which is something I really find fascinating about podiatry. I know a lot of people think of it as a limitation, but I think it's quite the opposite, because within that anatomical region, you can essentially practice any field of medicine that suits you, which could be musculoskeletal, neuro, dermatologic, surgery, trauma, orthotics, or anything else that you can think of. So I think it is a very, very diverse field of podiatry. It's very dynamic, and it's only been growing over the past few years.
Well said. I agree with that. That was a great description of our profession. And Tuba, could you share with our listeners the educational pathway to becoming a podiatric physician?
Yeah, of course. So typically what students follow, it's like a 4-3 model. So you do 4-4-3 model. So you do 4 years of undergrad typically, but you don't really need to complete undergrad. It's just like these set requirements that you need. So like biology, chemistry, physics, biochem, all of that. And then you also have to take the MCAT. So once you do that, then you enroll into a podiatric medical school, which are typically 4 years. And after your 4 years, you do a 3-year or 4-year residency, and you could choose to do a fellowship after that as well. But that's typically the pathway that most students take.
Well said. I think it's pretty standard, 4-4-3. Thank you, Tuba. So to set the stage for discussing the New York College of Podiatric Medicine, I'd really appreciate it if you would share your podiatric journey to date, perhaps where you're from, where you did your undergraduate work, how you discovered podiatric medicine, and then how you chose the New York College of Podiatric Medicine.
Absolutely. Thank you, Dr.
Karan, would you mind going first?
Essentially journey is kind of unique and different. I'm from Canada, and I'm from Manitoba. That's where I did my undergrad, University of Manitoba. And podiatry is not very prevalent there. There are podiatrists, but they're not DPMs, so not surgery-based. It's usually a chiropody, 3-year diploma podiatry that's usually practiced in that province. So I essentially stumbled upon podiatry by accident. And since the day I figured out what podiatry was, within 6 months, I was enrolled at NYCPM. So it was kind of quick since I figured out what it was. So I was looking for PA programs in Chicago, and I stumbled upon podiatry on the Rosalind Franklin website. And I looked into it, and I realized there's no DPMs practicing in my province. But once I looked it up, it sounded interesting to me, especially the surgery aspect and how diverse it is. So I emailed maybe upwards of 50 DPMs that were practicing in Canada. And I think a month later, only one of them responded back. And within 1 week, I flew over to 3 provinces, over to Alberta, and I stayed there for a week, shadowed Dr. Samir Lalani, and he actually went to NYCPM. So maybe that's part of the reason why I ended up at NYCPM. But essentially, once I shadowed him, looked at a couple surgeries in clinic, I could tell he was very well trained. And I kind of got a quick snapshot into podiatry, and I was right away, I knew that's what I was going to do. At the time, I needed physics 1 and 2, which I didn't have. I was close to graduating undergrad. So essentially, I took physics 1 and 2 concurrently, one at my school and the other one at an online school, because our school would not allow me to take both 1 and 2. So that's how motivated I was. I really wanted to get into podiatry and not waste a whole year. So I went through all of that. And 6 months later, I was in New York in August, taking my first ever class in podiatry. So that's kind of my journey with podiatry.
That's a great story. I don't know if I've met a student that's flown halfway across the continent to shadow somebody. So that says a lot. Thank you
Absolutely.
very much. Ronald, would you share your journey in podiatric medicine to date?
Yeah, so I'm originally from Puerto Rico, so my first language is Spanish, and then I'm gonna move to Virginia, where I went to Virginia Tech, and I had the opportunity to be an athletic trainer, or assistant athletic trainer, for the football team there, and there's a lot of lower extremity pathology in the foot and ankle, and it was my favorite exercises are always to do the ankle mobilization exercises. So little did I know, I was already kind of gearing up to be a podiatrist without knowing it. And I have essentially pancakes for feet. They're so flat. So I've been to podiatrist a couple times, and also with my parents for their problems. But I never knew that podiatry was a separate degree, and I thought it was an MD or DO, which there are MDs and DOs who specialize in on the ankle, but I didn't realize that podiatry could also be a separate schooling until I got an Instagram ad for NYCPM on my Instagram, and I was like, "Oh, this is interesting." And I looked it up, and then I saw that the podiatrist we had gone to was a DPM, and then I started looking into the field more and more, and I was like, "Wow, this is really interesting." And then I shadowed a podiatrist and had a great experience, and then I applied, and here I am.
Well, very good. It's right in your wheelhouse with the athletic training experience.
Yeah, it really worked out.
That's fantastic. Thank you. Tuba, what is your journey in podiatric medicine to date?
Yeah, of course, I'd love to share. So I'm originally from New York. I was born and raised here. I graduated from Stony Brook University, which is out in Long Island. So I've just kind of been in the area my whole life. And I knew that I wanted to, from the start, I knew that I wanted to be in healthcare. I just wasn't sure which pathway to go, MD, DO, PA, DPM, dentistry even. I just wasn't sure which route I wanted to take. And then my family moved out closer to Long Island. And so I knew my dad visited a podiatrist, but I never really went with him. But we had a language barrier problem with this new podiatrist because he didn't speak the language that my dad spoke. So I would have to go as a translator. So that kind of really dove me into the field. And I was I would go with him to the visits. I'd see what was going on. And it really caught my interest. And then that's how I ended up shadowing my dad's podiatrist, because I would go with him to these appointments. And that's kind of what got me into the field. And then after I graduated, I took a gap year, really focusing on do I really want to do this field, going shadowing more. And that's just how I got into it. And I applied to NYCPM, and here I am now.
Well, that's fantastic. I hear a common theme so often that the shadowing experience really is pivotal in the decision to go into podiatric medicine. Would you each just comment on that a little bit? Ronald, your shadowing experience.
Yeah, I had the pleasure of shadowing Dr. Barry Safran in Fairfax, Virginia, and it was really great because I wasn't really sure the extent of the disease and pathology that podiatrists could see and treat. And it was really cool because, in one room, you're, like neurologist, you're doing, Ipswich tests and testing for neuropathy. And then the next you're, a vascular doctor, you're, looking at pulses and thinking about peripheral arterial disease and things like that. And then you're doing musculoskeletal exams, sometimes all in the same patient or in different ones. And then talking about doing bunion surgery. So really just a variety of things, really, the amount of, kind of thinking that you have to do really excites me. It's, every patient's a puzzle, to figure out how to best help them and in the best way and, restore their quality of life. And I got to see that with, Dr. Safran, and it was really cool.
Well said. So Karan, when you flew to Alberta, what was your shadowing experience, and what was it during that experience that made you say, I'm going to be a podiatrist?
I think it was day one where every patient was so different. I think on my day one, I saw a 11-month-old of course, geriatric population, which I was soft spot for, and also anything in between. We had ankle sprains, plantar fasciitis. I saw a PNA on my first day, and just seeing how quickly Dr. Delannoy performed the PNA and essentially how smooth it went, you could tell that he was very well trained and he knew what he was doing. And the days following only reinforced the idea in my mind, and I could really see myself being there doing the exact same thing. And I think that's what really solidified it in my mind. So shadowing was definitely a monumental experience for me to make up my mind. Because reading about it, it's not the same once you see it, how integrated it is in the field of medicine. Because a lot of times we think podiatry is what I would have imagined would have been very different than what I saw. And I think that was a driving factor for me enrolling.
Fair enough. Well said. And Tuba, I know you had gone to the podiatrist with your father, but in that gap year when you started doing some shadowing, what really stood out to you?
Yeah, I think like mainly for me, it was kind of like the work-life balance that the podiatrist that I shadowed also had. Like I know, like of course, getting to that like point of having that balance is like a journey itself. But then in the end, the ultimate goal was like he had his private practice, and he seemed really happy in his career choice, and like that kind of like, because I also shadowed MDs and DOs before that as well, and like I would say like most of them were like, no, don't go this route, like do something else, like they kind of like steer you away from it. But then Dr. Kastman, who I shadowed, really was like, no, this is a great field. Like you're going to be really happy with your choice. You have like a lot of options that you can do. You can go into surgery, you can go into wound care, you can go into like just like the medicine side of it. There's like a bunch that you could do. And in the end, your work-life balance is also really great. So that was kind of like the selling factor for me.
That's great. It's such a common theme that when a student is looking at all the different health professions and you shadow all the different specialties, everybody comes back and says the podiatrists are happy. And I think that's because they do tailor their practice to the things they like to do. And that's just a wonderful aspect of our profession for sure. So I'm glad you all had that experience. So let's move on a little bit. I wanted to ask you about your involvement with the American Podiatric Medical Students Association, your leaders within your college. I was going to ask each of you how you got into APMSA and then what your current role is within APMSA. Since you're the soon-to-be graduate, Karan, if you wouldn't mind sharing your experience first.
Absolutely. I was actually convinced. I knew I was going into APMSA before I even decided which school I was going to.
Really?
Be part of my personal statement when I applied to different schools. And the reason being was I was very involved in undergrad, and it really added value to my experience as an undergrad student. I believe I created channels, found different resources, and essentially it was overall a more fulfilling experience for me to give back and also kind of work on myself and essentially just work on my skills in different areas instead of just being a student and going to school and taking lectures and going home. I think it added a lot of value to who I am today. And I think for that reason, when I was applying to podiatry schools, I looked for an organization that represented as closely as possible to an organization that I was already part of. I used to be a student union director at the University of Manitoba. And APMSA was the closest organization that encompasses all students for all podiatry schools, and it's an advocacy and leadership organization. And so that's for that reason going in, I knew I would be running for APMSA. And so that's the reason I ran. I never thought I would be the president, but that kind of came with time, where for me, it's not about the position. If I feel strongly about something, I would voice that. Even though I'm not a big public speaker, it's not something I like to do. I'm not a politician by any means. But over time, I'm learning just to be able to voice my concerns. And even if you're the only voice in a room, I think if it's something needs to be said, I won't be scared. Just because I'm not a good public speaker, I would still put that point forward. And I think that was the reason I ran to be president. Unfortunately, I didn't end up winning. And it's been a great learning experience. I'm still learning to this day. And I think leadership is more about empowering others and providing them channels than doing things myself. And yeah, it's been an overall great experience, and it's only added value to my life as a podiatry student. And yeah, that's one of the main reasons I ran.
I was going to ask you what your leadership style is, and you answered it for me. You empower others, and that's fantastic. And congratulations on being the national president. That's quite an accomplishment. Well done.
Thank you.
Ronald, tell us about how you got involved with APMSA and what your current responsibilities are.
Yeah, so my current position is I'm part of the social media committee, part of the PR committee, and so follow us on Instagram on the APMSA, official APMSA. But yeah, so really, what I'm really passionate about, especially from the beginning, is student recruitment and letting students know that podiatry is a thing and a very cool career path. That I said I'd seen podiatrists, but I thought that they were, MDs or DOs, and um, a lot of people just simply don't know about podiatry. When they do find out, when they shadow, like, the retention rate of students applying to the podiatry school is like super high once they actually find out what it is. So I expressed that to my Dean Lee, who's really great. And she said, well, APMSA is great. It's a national organization and, you can work with them and the different organizations in podiatry to reach out to students, college, high school, or any postgraduate level as well. And then I spoke to who's now Dr. Nayab Khan, who's a graduate of NYCPM now, and she was really, a mentor to me in that. And she was also in the PR committee, and she taught me a lot about how to make posts and filters and all that stuff that goes into Instagram. And yeah, so that's what I currently do now.
Fantastic. Thank you very much. So Tuba, how did you get exposed to APMSA and what are your current responsibilities?
Yeah, I'd love to share. So I think I was always a person who stood for advocacy, and I was really involved with that in my undergrad. I was actually an intern for the Department of Women's Services in the Suffolk County Executive Office, and we really advocated for poverty-stricken areas in Suffolk County that cater towards women and being really advocating for them. So that kind of really stemmed my interest in APMSA, where it was kind of the legislative part where you could advocate for podiatry students as well, and resources that should be available for us, or just anything like that. So that kind of really stood out to me. And one of the second years with Ronnie as well, really encouraged me to apply and do it. And I got elected in. And another position that I hold with APMSA is I'm the CPME liaison for APMSA. So that's basically the Council of Podiatric Medical Education. So I attend their meetings as well, and also advocate for students on our part, and tell them what are students thinking about the recruitment crisis, what's our idea on it, like things like that. So that's where my involvement with APMSA stands.
That's great. And I commend all three of you for taking on these leadership roles because, the curriculum at the podiatric medical schools is hard. And really this advocacy and representing your classes, not only at New York, but nationally, is really like icing on the cake. So I commend all of you for that. So let's shift gears a little bit. Let's start talking about the New York College of Podiatric Medicine. So what I was hoping we could do is go through each year and just talk about that year, the academic coursework and workload, and that will kind of start the ball rolling for talking about NYCPM. Tuba, would you mind talking about the first year experience?
Yeah, so I just completed my first year, so I think this is a perfect topic of discussion for me. So basically, you start your first year just taking all your preclinical classes. So we take biochem our first semester. We take histology, physiology, bacteriology, microbiology. All those classes are just mainly your preclinical classes to get you used to the curriculum. And we do that all of our first and second year. And then we take anatomy as well. Our anatomy is divided into just general anatomy and then lower extremity anatomy. So we take that our spring semester of the first year. And we also have the lab with that where we get to do cadaver dissections, which I think is really pivotal in learning about the different muscles, insertion sites, origins, all of that. You get to see that yourself in lab, which is really eye-opening for me because I didn't have that. I never took anatomy in undergrad. So doing that over here was really really rewarding for me as well. So that's mainly just the first year. You just do your clinical classes as well. Preclinical classes, sorry. So, yeah.
Very good. We do the same thing in Arizona. We have for anatomy, we have gross anatomy. And then after the students go through it once, then we really focus in on the lower extremity anatomy with the dissection lab. And that's crucial because you'd all agree that anatomy is so important for not only biomechanics, but the surgical aspect of the field. So that's fabulous. Well, thank you, Tuba. Ronald, you just finished your second year. Could you share with us your second year experiences and the coursework that you had to take?
Yeah, of course. The second year, at least at NYCPM, is really kind of the glue between connecting your didactic kind of preclinical knowledge and then trying to start to think like a physician in your clinical knowledge and preparing you for your third year. Where we start being in clinics and such, which is why I'm in my scrubs now. I just got out, but so, we take classes like physical assessment in the lab where you learn how to work with a patient and different tests that you do. Infectious diseases, which is kind of the clinical application of the microbiology that you take in your first year. We take lower extremity lab actually in the third semester. This is the first semester of second year. We also take pharmacology as well. And then we also take a really cool class called research methodology, which was really helpful, especially someone like me. Like I went straight from undergrad into podiatric school, so I didn't have any experience, with like writing a thesis paper or anything like that. So it was really a great introduction on how to critically read literature and such. And then in the fourth semester, it's even more clinical when you take like dermatology, neurology, podiatric medicine one, biomechanics, and functional orthopedics, which are my personal two favorite courses that I took, and then anesthesiology and podiatric surgery. And then after that, part of fourth semester is you take clinical skills after the kind of like didactic portion is over, but in that kind of summer while you're studying for boards to kind of prepare you for going into clinic. So when you start third year, it's not the first time that you've been in clinic, and you can kind of learn from the year above you.
Yeah. Very good. One of the questions we always get from students is, what do you do to help prepare students to take boards? Do you have board reviews? Do you get some time off before boards? How does that work in you?
Yeah, of course. So we finish our fourth semester technically in May. Yes, in May, and then the fourth semester kind of goes on into the summer, but your classes are over. You're taking that clinical skills class. So that's normally half days that you're in clinic for the most part, learning, and then the rest of the day you're completely off to study for boards. And we have board reviews. Our professors do awesome reviews. They send us PowerPoints, and they do Zoom reviews and in-person reviews, going over the high and sometimes low yield as well material that's going to be on the exam. And then upperclassmen also, especially when your clinical skills, like, when you're waiting around or whatever, you ask them questions like, oh, how'd you do this for in this subject? Like, what resource did you use? And that was really, really helpful just to hear about everyone's perspective, because really the most important thing when you're studying for boards is to just do something. And as simple as that sounds, like, as long as you pick a couple of resources and then just go, that's really the biggest thing, is to just keep the ball rolling throughout. And so essentially you have 3 kind of unfettered months to study for boards. And then a couple weeks before you have, no clinic or anything. And then just for boards studying.
Fantastic. Thank you. Well, of course, boards are the first big hurdle, right, in our educational experience. So Karan, if you wouldn't mind sharing, once boards is over, and you start your third year, what's it like at the New York College of Podiatric Medicine?
Third year was actually my favorite year so far. I'm enjoying the fourth year even more now that I'm an externship, but that was the first time where we enrolled to be clinicians and to treat patients, to be in the hospital at the clinic. And third year is the first time you're exposed to that, and it's really refreshing. You finally see the light at the end of the tunnel. So I personally really enjoyed my third year, being able to be at the hospital, at the clinic, learn from our seniors, as Ronald mentioned, and just being in that element and that environment, because that's something we're going to be doing for the rest of our lives, essentially. And it was really refreshing to see that I really enjoyed being there and just learning every single day. And yeah, so far, I personally really enjoyed third year. At NYCPM specifically, I know we do a great job at making sure our students are prepared going into externships. We have a wide patient population, lots of pathology, lots of clinic experience, and I believe that was monumental to my learning. And when I was my first externship, I felt very prepared, and I thought it was a great experience. But it's also up to the students. So in the clinic, you can be working alone, paying attention, doing the most that you can to facilitate that learning, or you could do the least amount as possible. And that just comes down to you as an individual. And in the third year is when things go from, PowerPoints and giving you slides to self-induced learning. And I think that's one of the big things to take away for a third year, because it's a one whole year. If you're maximizing your learning every day, you're going to be a whole different person by the end of the year versus not taking advantage of that. So I think that's for NYCPM students or outside, I would urge them to really focus in the third year, just in clinic, and do as much as you can, absorb as much as you can, because it will pay back at the end. But I really enjoyed third year personally.
That's great. So how many months of clerkships do you get to do at New York?
At New York, we get to do 5.
5. And where are you right now, Karan?
Right now I'm at Brooklyn Hospital. My first one was in Connecticut, and I have NYPQ, Montefiore, and NYU coming up.
Fantastic. Oh, well, that's a great experience. Thank you so much. So one of my most fun aspects of doing these interviews with the students are the professor shout outs. So if each of you could name a professor or two that have been instrumental in your educational experience, that'd be great. Tuba, you want to start?
Yeah, I'll start off. I think Dr. Wade, she teaches physiology 1 and 2 for the first years. She's amazing. She does whatever she can to really help nail the information down to you. She does review sessions. She'll really go out of her way to make sure you do well in the class. And I think not when you're in grad school, not a lot of professors are like that, but she really does go the extra mile. So I really enjoyed having her as a professor and kind of like a mentor as well.
That's great. Thank you. Ronald, how about you?
Yeah, I have a couple. Dr. Russell Volpe, he teaches our functional orthopedics class or courses that we take throughout our time, and his knowledge of just the foot and ankle and everything that goes into any pathology is just amazing. And he takes really complex topics and papers, and then he synthesizes it on slides where it feels natural the way you learn it. And it really kind of propelled my knowledge just from taking the first course of how the foot and ankle actually work in relation to the rest of the leg and body. And I'm really excited to take FO2, which will be coming up soon because we're in a block situation. So I'm in medicine right now, and I'll be in orthopedics in a couple of months. So I'm really excited for that, to learn even more from him about that. And then Dr. Samuel Adeboyega, who's our clinical dean, medicine dean, and he's just goes above and beyond for the students, holding reviews. And I literally had a 2-hour conversation with him over the phone, on a Sunday, when he can be doing whatever, just about externships and life and stuff. So it really goes above and beyond for the students.
Excellent. Thank you. Karan, any professor shout outs for you?
I have to agree with Ronald on this one. I really enjoy Dr. Volpe's courses, FO1 and FO2. And Ronald, you're looking forward to FO2. It's also another great course. One thing I love about functional orthopedics was how conceptual it is. And it's not about memorizing slides, but really sitting down, sometimes understanding things. And I really enjoyed that aspect. And he taught it really well. It was one of the lectures that I really enjoyed. It was not about just getting through the lecture or the PowerPoint. It was essentially learning really important skills that we need as podiatrists, the biomechanics aspect. One of my favorite stories about Dr. Volpe is first week of FO, functional orthopedics. I was just walking down the hallway. At this point, we had learned very little. And he just comes up to me. He's like, you have partially compensated equinus. And I had no idea what he was talking about. And I looked at him like, is that bad? And he's like, well, it depends. And then he walked away. And then I spent the next 2 hours learning what partially compensated equinus was. But no, he's one of my favorite professors. He taught the course so well. I also have to agree with Dr. Adeboyega. He just goes above and beyond. We had reviews with him going to midnight the day before exams. And he always says, I don't care about how you do on the exam. He only cares about if you're going to learn the concept and do well on the boards, which I really respect him for that. And one more shout out I have, it's not a professor, it's Dean Lisa Lee. And she's one of the biggest proponents for student leadership, student enrollment. And essentially, she's for the students at our school. And she was the one that interviewed me. And throughout this time, the support that I've received, and as well as other students, I'm sure, has been tremendous. I don't think I would be where I am if not for the support that I received from NYCPM, but especially Dean Lee. So those are my 3 shout outs.
That's great. So while we're on the academic agenda, I thought I'd ask each of you to give a tip to incoming students. If you were to give them one tip to be academically successful, what would it be? Tuba.
So I'll start off. I'll say that I think like really staying on top of your lectures is really important in your first year, because at least for like my experience in first year, it's kind of like you're exam chasing. Like at least at NYCPM, it's like you have an exam almost every week, sometimes twice a week. So you're really like just always studying. So if you stay on top of your lectures, you do like the lectures that day, like don't like skip a day. I think it really helps you. My fall semester, I kind of like learned the hard way that you have to really stay on top of your stuff. So I would give that advice to other people to like have a successful academic year.
A great tip. Ronald, what would you say?
I think kind of going off of what Tuba says, we have a pretty rigorous academic schedule, and the best way to succeed is to stay consistent. It's a marathon, not a sprint. And one of those things I think is kind of getting used to doing things when you don't feel like doing them, like studying even when you don't feel like studying, because you're not going to feel like studying every day. And, so if you're considering going to podiatric medicine, I suggest doing things, maybe not studying, but doing things that you don't feel like doing. Most days, to me, start doing it 5-10 minutes a day, 15 minutes, whether it's, if you don't like running or, cooking or whatever it is, but to kind of get used to mentally getting used to doing things when you don't feel like doing them, because you're not going to feel like studying every day, but you kind of have to do it most days, especially to stay consistent, that spaced repetition and all that, stuff with learning. So I would recommend that.
Great advice. Karan, what recommendations would you give?
I echo what Tuba and Ronald said 100%, staying on top of things. And I think, as Ronald said, with the boards, the biggest challenge for me was just doing a little bit every day. And I feel like at one point I got into the flow, but it's hard. But I think it's just keep changing things up and picking a topic that if you get bored, pick a different topic and do a little bit at a time. And I think one other thing that helped me personally a lot was being involved and having the community around me. And because you don't need to recreate the wheel. A lot of the wisdom is going to be passed down to you, what works, what doesn't work. So I think finding what works for you and also having a community around you that will help you. I remember our senior who convinced me to run Nina Dabrowski. I remember for me and Xenia, she would sometimes tutor us for free for hours at end for hard courses, just because she wanted us to do well. And I think just having that and having the community and then giving back once you're done and passing it on to the next coming class, I think that's one of the big things that NYCPM does really well. Ever since I joined, we've always had seniors passing down resources, advice, and we always had someone to reach out to. I think that for me helped me a lot. And I think that's very important. It's all about teamwork. You don't have to do it alone. Seek help when you need it, and that's what it's all about.
Very good. So on the lighter side, I like your term, Tuba, exam chasing. That's kind of what it's like. I agree with you. What do you do to relax? What do you do to recharge the battery between these series of exams? Tuba, what do you do?
Yeah, so I currently live at home because I'm from New York. NYCPM's not too far from me. So I love spending time with my family. I have a cat that I just recently adopted, maybe 3 months ago. So I love playing with her. She's super friendly and she just loves playing. So I always play with her when I have downtime. I always go to make sure I go to my family. My family's really my biggest support system. So any single time I'm stressed, even while studying, I'll have a breakdown and I'll just go to my mom and she'll calm me down and tell me it's okay. You can get through this. You've been this far, you've gotten this far. It's only a matter of just one exam. So and my family's really the biggest support for me. So that's how I kind of de-stress a little too. And my cat.
And your cat, for sure. Ronald, what do you do after the exams and you need to take a break? How do you recharge your battery?
I really enjoy eating food, anyway. So I like to cook and figure out ways to make, healthy things taste good. And I also, me and my roommate like to explore New York and and see what it has to offer and just try new food. And just to echo what Tuba says, I definitely I talk to my parents a good amount, and also my girlfriend is a great support system, to listen to everything that goes on. And I think it's important, to talk to people also outside of the podiatric field just as much as it is to talk inside, because it's, sometimes when you're in school, you kind of get really like kind of one track minded and you kind of forget about like, the current events or whatever and stuff going on. So it's good to have that kind of connection to sort of the outside world and remember like, oh, like there's other stuff going on, outside of like, like there was like exams and, clinic and stuff. So.
What an incredible city to live in. There's never a shortage of things to do in New York. That's for sure. Karan, what do you do to recharge the battery?
So I was not the best at this in my first 3 semesters, I have to admit. I essentially stopped, following any of my hobbies, things I used to love, just because school and just pressure. And I think that kind of did not serve me very well the first 3 semesters. I learned that lesson the hard way. In my 4th semester, I started doing things to de-stress again. I love playing ultimate frisbee. I like running. I like eating food, exploring the city, all of those things that Ronald mentioned. But I believe I essentially, part 1 was COVID and everything was kind of shut down. And the second thing was just the adjustment because I moved here from Canada. So I did not have, a friend group or anything like that initially. So I kind of just put all the hobbies aside and I'm like, I'm just going to focus on school. But that sort of backfired. I think that was not the healthy way to deal with it. So I would urge students coming in to really, do things that make you happy, where you can de-stress, because you will not get burnt out easily if you do those. But I learned that in the 4th semester, which is the hardest semester, but to me, it was the most, the one where I kind of like essentially just sweep through without much effort. But that's because I was finally doing things and kind of had a schedule down and I knew what works and what doesn't work for me. So it is a learning curve. Coming in from undergrad, going to be a much higher post load. It's going to be a lot of things that you have to sacrifice. But I think if you can early on build good habits and learn from your mistakes, I think that's the best possible way to go about it. Because everyone's going to make mistakes. They're all going to be different mistakes. But as long as you don't make it twice and you grow from that, I think that's all that counts.
Well said. Well said. So my last question for all of you is, what would you tell a prospective student, an undergrad student, about podiatric medical school and the profession? And then lastly, what would you tell them about New York College of Podiatric Medicine? Ronald.
Yeah, I would say, get ready for a really rewarding experience. It's really what you get what you put into it. And it's a lot of hard work, but really I've had the opportunity now to start to be in clinic and all the studying, Tuba, it's just, there's a lot at the end of the tunnel, all the studying and everything, like, what am I learning this for? Like, it really shows itself and it really is rewarding, right? I see a patient, I just like see the slide like come to life, and all that studying, really makes it worth it, because then you see the patient, you recognize what's going on, and, you talk to the attending, and then you can say what you think, and you talk to a treatment, and then you turn the frown upside down, if you will, even though we're not dentists, but and make them, their day better. And that's really it's important to keep that in mind, when you're studying, that there is a reason, there's a reason why there's so many exams, to work on your time management skills, like how you think under pressure, like all of these things, like it's not pointless, there's a reason why, you go through what you go through. And you kind of go from a caterpillar into a butterfly, I'm still like in that process, but that's, the goal. And specifically at NYCPM, I think they do a fantastic job at really challenging you, but not pushing you too far. But I mean, I've grown so much as a person and as a student in the past couple of years, and I never knew I could learn so much in, such a small amount of time. And really just the community here is really awesome. Just how Karan and Tuba have been talking about, like, the upperclassmen are always there for you, whether or not they're your TAs or tutors. Like, all you have to do is ask. And all the professors, like, I wish first year I took more advantage of it. Like, when they say there's an open door policy, like, there's an open door policy, as long as they're not in a meeting, like, you can always email or just see if they're in their office. And, Dr. Baraga definitely knows, I'll talk to him and stuff. And so that's really what I like about NYCPM.
That's great. Thank you so much. Tuba, what would you tell a prospective student about podiatry first and about the New York College of Podiatric Medicine second?
Yeah, of course. So I think like the main thing for me with podiatry is just like how vast the field is. Like there's so many things that you can do in the field itself. Like there's derm, there's like radiology, there's again, like I said, wound care, like surgery as well, which is really like the driving factor for me. There's just like so many different like things that you can even like subspecialize in with podiatry, which really made me super interested into the field. And then going off of what Ronnie said with NYCPM, it's like really like the community that we have here is like really special. Like I was going to add on previously, like one of the upperclassmen, Trey, who was our student government president last year. I remember during my first year orientation, he said something that really stuck with me. He was like, if you like, you're going to be very overwhelmed at times and things are going to start to catch up to you. But if you could take like a Friday night, just a Friday night to yourself and really like relax and unwind, if you don't have like a rigorous exam coming up next, like that's really going to like do like a good amount for you. And that's something that I like kind of followed like his advice. Like every Friday night, if I didn't have like a rigorous exam coming up on Monday or Tuesday, I would just take that time to myself, like no studying, putting the books away. And I think that really helped me like unwind. Because it does get a lot, like it starts to catch up to you. So having that time for yourself. And I think NYCPM is also like really diverse. Like I grew up and I was raised in New York City. So I always really wanted that diversity in my grad education as well. And going to Stony Brook, which is also a very diverse undergrad school, like I wanted that to kind of like follow me. And NYCPM really is like in the middle of like NYC, like the melting pot. So I think the community that we have here is like amazing, and I wouldn't really trade it for any other school. So yeah.
Oh, well said. Thank you. And for the final word, the president, national president of the APMSA, Karan.
Thank you, Dr. Jensen. I have to echo what Ronald and Tuba said. Podiatry specifically has a lot to offer, and I think it's up to you to kind of go in, figure out what it is that you want to do with the profession, and but the possibilities are essentially endless, and it's only evolving and growing every single day. And the fact that it's a small profession, we do have a say, and we can shape where the profession takes us in a decade from now. I think it's a snowball effect, and it's what you put into it. So as a practitioner, as a podiatry student, even being involved as a student, you can do things, you can change and shape your future and the future of our profession, essentially. And I think that's one of the biggest things that I love about podiatry, how small and dynamic it is, and it can change very quickly. And I think if we have good candidates, good people going in and putting in effort, we have a bright future to look forward to. NYCPM specifically, I believe, again, as Tuba and Ronald said, great community. That's something that I value a lot. I'm a self-learner, so a lot of times I don't reach out to professors, and that's maybe I should have, but a lot of times I'm a self-learner, so the things that I value more are community, and if there are people I can reach out to when I do need the help. And that was always available at NYCPM. The resources are there, but it's up to you to go reach out and ask for them. But there's a lot of resources at NYCPM and a great community, whether that's the seniors or the faculty. And they've always been very supportive to all different classes that I've seen so far.
Well said. Well, I wanted to thank all three of you for taking time out of your busy schedules and sharing your educational experience at the New York College of Podiatric Medicine. I'm comforted because I know our future of our profession's in good hands with leaders like you coming up through the ranks. So thank you again, and congratulations. I will be sending each of you one of these Dean's Chat cups. I know you're going to have a lot of long nights and early mornings, so you can drink coffee or your caffeinated beverage of choice. And until next week, I wanted to let all of our listeners know we appreciate them being here. And if you're on Spotify or on Apple Podcasts, please give us a 5-star rating. And of course, if you're on YouTube, please become a subscriber. So until we meet again, cheers, everybody.